Hello, my name is Terry Lynch, medical doctor, psychotherapist, mental health educator, best-selling mental health author, and the provider of a recovery-oriented mental health service. If you are not familiar with my work in mental health, here are some testimonies from people with whom I have worked over the years. Briefly, some information about me. I qualified as a medical doctor over 30 years ago now, and during all of this time I have been a practicing physician. I am fully registered with the Irish Medical Council. I have been a fully trained psychotherapist for over 15 years now, and I am fully accredited with the Irish Association of Humanistic and Integrative Psychotherapy. I have been providing a recovery-oriented mental health service for over 15 years now, and this service is attended by people who have been given a psychiatric diagnosis from all over Ireland and beyond. I am a mental health author, the author of 3 books to date. My first book, Beyond Prozac, reached number 3 in the bestsellers list in Ireland in 2001. I have been appointed by the Irish government to several expert mental health groups over the years, including the Expert Group on Mental Health Policy, which formulated a Vision for Change, Ireland's current mental health policy document. I was also appointed by the Irish Department of Health and Children to the Independent Monitoring Group for a Vision for Change. This group was set up to oversee the implementation of a Vision for Change, and I was subsequently appointed to the second Independent Monitoring Group for a Vision for Change. I was also appointed by the then Chief Executive Officer of the Irish Health Service Executive, the HSE, Professor Brendan Drum, to the Expert Advisory Group on Mental Health. There is currently a split in the world of mental health, a split that is not in the interests of people attending mental health services. People who have been given a psychiatric diagnosis are primarily seen as having a medical problem. Consequently, the main thrust of the interventions made available to them is medical. People who have not been given a psychiatric diagnosis are far more likely to be attended to by counsellors, psychotherapists, and psychologists. There is some overlap, of course. Some people who have been given a psychiatric diagnosis attend therapists in addition to GPs and psychiatrists. But, by and large, this divide applies, and the people who lose out are those with psychiatric diagnoses such as bipolar disorder, schizophrenia, and so on. This group loses out because the emotional, psychological, social, and other aspects of their experiences and behaviours receive little or no attention. I am creating a course designed to address this gap, entitled Working Therapeutically with People with a Psychiatric Diagnosis. This course is for mental health professionals who would like to increase their understanding of psychiatric diagnoses such as depression, bipolar disorder, schizophrenia, obsessive-compulsive disorder, personality disorders, eating disorders. Suicide also will be addressed in this course. I have been creating, and I will continue to create, mental health courses for both mental health professionals and the general public. To date, I have created online courses for both mental health professionals and the general public entitled Depression, Its True Nature and Bipolar Disorder, Cracking the Code. And there are many more courses to come. As I mentioned earlier, I am creating a course for mental health professionals entitled Working Therapeutically with People with a Psychiatric Diagnosis. Here is some information about this course. I am the course creator and presenter. The course will be held in Dublin at the City West Hotel. The course schedule will be one Saturday a month for 8 months, commencing in September 2017, each day from 10 a.m. to 5 p.m. There will be a limited number of places available for this course. The course learning outcomes include understanding the DSM, the Diagnostic and Statistical Manual, and the process of psychiatric diagnosis. Understanding the emotional, psychological, social, and biological aspects of the most common diagnoses, including depression, what is described as general anxiety disorder, bipolar disorder, schizophrenia, obsessive-compulsive disorder, and eating disorders. A clear understanding of practical guidelines for working with people with a psychiatric diagnosis. Increased confidence and effectiveness in working with people with a psychiatric diagnosis. A need-to-know understanding of medical interventions in psychiatric diagnoses, including medication. A comprehensive understanding of the major links between trauma and psychiatric diagnoses. And clarity in relation to working with clients at risk of suicide. In relation to continuing professional development, or CPD, 44 hours will apply. Participants who complete the course will receive a certificate of completion. The price of the course is €960. A deposit of €320 secures a place on the course. And as I mentioned earlier, the numbers will be limited. My contact details for further information are terry@drterrylynch.com, 353-087-659-2580, and my website is www.drterrylynch.com. By greatly increasing their understanding of the psychiatric diagnoses, such as depression, what is called general anxiety disorder, bipolar disorder, schizophrenia, obsessive-compulsive disorder, and eating disorders, for example, mental health professionals such as counsellors, psychologists and psychotherapists, and other mental health professionals such as social workers, occupational therapists, and so on, can considerably enhance both their effectiveness in their work with people who have been given a psychiatric diagnosis and the lives of the people who attend them. And this is one of the main purposes of my course. So if you'd require any further information, please feel free to contact me at the contact details I provided earlier. Thanks for watching.